Hey everybody, it's Sherry Tuckus, the Green Nurse. And tonight I'm here to talk about medical cannabis nursing consultations. So basically, people will say, "Oh, Sherry, do I need a nursing consultation? You kind of figured it out on your own." I'm like, yeah, I figured it out on my own. However, it took 2 years. So truly, when I started my cannabis journey at the end of 2014, I truly wish that I had a nurse that I could have contacted to help me. I started my cannabis journey at the end of 2014. It was a nurse that came to my home and told me to get with the program. She said, Sherry, cannabis has been medically available in Massachusetts since 2012. It's now the end of 2014, and you are sick, you're suffering, and you're dying. And she was right. So she told me to get with the program, and so I did. She brought me over a cannabis joint. I couldn't believe it. And I said, you're right, I have nothing to lose. I truly didn't understand cannabis as medicine. I only understood it to be recreational. So once I took that first puff, I felt like my head was cracked open and consciousness poured in. I was pulled out of the story and trajectory of sickness and illness. And I started to see things from a different perspective. And it truly lit a fire under my ass to figure out how to make this work for me. I truly had a lot of wonderful, wonderful moments of being pain free in that moment in time. And I truly knew that this was something that I was going to be able to embrace, but I just had to figure out how to make it work. And so, over the course of 2 years, I figured out how to make cannabis work for me so I can use this plant all day, every day, and use it in a way where I'm not impaired. Okay, so there's nothing wrong with feeling elevated. There's nothing wrong with being high every now and then. But for medical cannabis patients, truly what we're using it for is we're using it to relieve symptoms of chronic debilitating illness so we can improve the quality of our lives so we can live our best lives. Anyways, to get back to that, back at the end of 2014, I truly wish that there was a nurse that I could have spoken to or an organization that could have helped me to figure out how to make this plant work better for me. So basically, do you need a medical cannabis nurse consultation? Well, no, not really. You can figure it out on your own. However, I've kind of done the homework for you, and so have all of the cannabis nurses at thegreennurse.com. So basically, I'm just going to give you a little self assessment. I'm going to ask you a few questions. And if you've answered yes to any of these questions, seeking a cannabis nurse consultation might help you to reach new levels of wellness sooner instead of you doing it on your own. So here we go. 1, do you want a personalized, individualized approach to optimize your cannabis results? 2, are you seeking medical cannabis for an ill child or an adolescent? 3, do you want to reduce your reliance on pharmaceuticals? Are you on multiple pharmaceuticals? 4, have you been diagnosed with cancer? 5, do you have a cardiac or respiratory condition, an arrhythmia, hypertension, asthma? 6, do you have diabetes? 7, do you have a mental health disorder and on multiple medications? Do you have schizophrenia, bipolar, depression, anxiety, PTSD, agoraphobia, sleep disorders? 8, are you seeking to use cannabis to manage and improve chronic or complex medical conditions? If you answered yes to any of the above questions, seeking a nurse consultation from us at The Green Nurse is truly going to help expedite the results that you're going to get. We've done all of the work for you, a lot of trial and success. We have tips and tricks to help you to reach new levels of wellness sooner. So please visit us at www.thegreennurse.com. And if you have any questions, feel free to reach out at info@thegreennurse.com. We're truly here to educate and empower you to make decisions that are best for you. So come join us, come learn with us, and remember, it's about living your best life.